Hi everyone. Today we're doing a quick review on how to find and enroll in the best Medicare Part D drug plan using the Medicare.gov Plan Finder tool. So stay tuned. So I'm starting off here on the Medicare.gov homepage, and Medicare.gov changes a little bit from time to time. So when you watch this video, the Medicare.gov homepage may look a little bit different than it does right now. They usually change it at least once or twice during the fall annual election period. But I'm going to walk you through the steps so you should be able to navigate your search and your enrollment, even if the site looks a little bit different than this. So I'm starting off by going to where it says sign up and change plans. And I'm going to hover over that and scroll down to where it says find health and drug plans. Sometimes in the fall, especially during October 15th to December 7th, which is the annual election period when you can change your Part D drug plan or enroll in a new Part D drug plan. They'll put that Find Health and Drug Plan button right here on the homepage. So you may be able to look for it there. For today's purposes, we're finding it here under the Sign Up and Change Plans tab, and you click on Find Health and Drug Plans. And once I click this button, it gives me the option to log into my Medicare.gov account or to just continue without logging in. I do recommend creating an account. It can be very useful in saving your medications so that you can go back in and review those from year to year. And you also have the option of even pulling up medications that you've recently filled at a pharmacy. So there are some nice features there if you create an account. For today's purposes, I'm going to continue without logging in, and then it's going to ask me what type of plan I'm searching. If I want to find a new drug plan, I just search on drug plan Part D, then enter in zip code. I'll enter in my zip code in Austin, Texas, and it only gives me one county choice. And from here, it asks if we get help from any of these programs. I'm going to click, I don't get help from any of these programs. Of course, if you do, you would want to click that. And then I'm going to click yes when it asks me if I want to see drug costs when I compare plans. Ask me how do I normally fill my medications. When I'm doing a search for one of my clients, I like to check both. And so that way I can see the price for mail order versus the price for retail pharmacy. It'll show me both. And we can see if there is a savings there to be had if you decide to opt for mail order. Now I'm going to start by entering in the names of my medications. So I'm going to start off by just doing a couple generic medications. These are some popular ones that we see, and it gives me the options of changing my dosage and how many times a day do I take it. I'll add in another one and add that drug and add that to my list. For now, I'm just going to do these two. I'm going to go back in and do another search with some brand name medications in a moment to show you the difference. But for right now, I'm going to click Done Adding Drugs. It gives me the options of different pharmacies. Mail order is already selected, and then I'll also just choose CVS Pharmacy too. So clicking Done there shows me all of the different drug plans available in my area. There's 30 different prescription drug plans, and gives me options of how I want to sort them. I always sort them by lowest drug and premium cost. This is the way that you can view which plans will give you the overall lowest out-of-pocket cost for the rest of the year when you add up the monthly premium of the drug plan along with any co-pays that you're going to have to pay for your medications. So you can scroll down and see, it shows me how much I would pay at a retail pharmacy, how much I would pay at a mail order pharmacy. This dollar amount is telling you how much you'll pay for the whole rest of the calendar year when you add up the monthly premium and any co-pays you're going to have for the medications you've plugged in. So you can scroll down and see that these numbers are just a little bit higher, so that's why this one comes out on top. And there are many different plans at different prices. Let's start off by clicking on the plan that came out on top and talk a little bit about how that plan works. So when I click on plan details, it shows me the total monthly premium of the plan. It also shows me the drug plan deductible. This is something I really wanted to mention because a lot of people wonder, hey, I'm only taking these two medications that are pretty inexpensive drugs. Why would I sign up for a plan that has this huge drug deductible? And that's a really good question. And it's also really important to know, and on the Medicare.gov website, they don't make this very clear, that many of these Part D plans show a drug deductible, but they actually have a $0 drug deductible for tier 1 medications, or sometimes a $0 drug deductible for tier 1 and 2 medications. So oftentimes this drug deductible is only applying to any medications that you're taking that fall into tier 3, 4, or 5, which is your higher tier, generally your brand name medications. So when I scroll down, it shows me what I'm going to expect to pay at CVS Pharmacy, which is what I picked as my pharmacy. It shows me that this is a preferred in-network pharmacy. Preferred in-network means my cost share will be the lowest there compared to any other pharmacy. And it also shows me that both of these medications I'll pay $0 for. So even before I meet the deductible, these medications are $0 copay for me. So I know that these medications are not subject to my plan's $435 drug deductible. If I scroll down further, it shows me my estimated costs per month in medication copays for the rest of the year. And it also shows me that I would pay $0 copays for these medications at a mail order pharmacy. So this would be the plan that I would probably enroll in. It's a pretty low monthly premium, and I'm going to pay $0 as long as I either use a preferred in-network pharmacy like CVS or if I use mail order. I'm going to go back now and enter in a brand name medication to see how that changes things. So here I can edit my drug and pharmacies, and a medication I'm going to enter in would be, I'm going to enter in an inhaler. I know that Advair is a popular inhaler, and it asked me if I want to use the lower cost generic version or if I would like to keep the brand name. I'm going to add the brand name instead. And then it asked me how often do I fill this. Now, currently on the Medicare.gov search tool, the least frequent option it gives you is every 3 months, which I don't really like. I wish it would give you every 6 months, every year. I know that many of my clients, only refill a medication maybe once or twice a year, but they do give you every 3 months. So you may want to adjust your dosage and think of that when you're looking at those total annual costs for the rest of the year if it's a medication you don't actually refill as often. For today's purpose, I'm going to choose every 3 months, add that to my list, click Done Adding Drugs, keep my pharmacies the same, and it'll sort my plans again by lowest drug and premium cost. So you'll see here that now there are some new different plans that are coming out on top for me as the lowest total drug and premium cost because I did enter in that more expensive brand name medication. The plan that's coming out on top now is a WellCare plan again, but this is a different plan that has a higher monthly premium and a much lower drug deductible. This one has a $0 drug deductible, but it's $74 a month versus the other plan, which was $14. When I click on the plan details, it shows me what I'll expect to pay every month, and you can see that since there's no drug deductible on this plan, just shows me right away what I would pay for my medications. Now, actually, these two medications that were $0 on the other plan, I actually have to pay $1 for these medications on this plan. But this plan offers better overall coverage for this Advair medication for the rest of the year, since I'm not needing to satisfy a large deductible before this is covered. You can play around with the different ways to sort plans. There's lowest drug deductible I can sort by, lowest monthly premium. But if you are taking medications, I do recommend sorting by lowest drug and premium cost. If you decide that you want to go ahead and enroll in one of these plans, you just click the enroll button. It's very straightforward and it tells you exactly what you'll need to have handy. And then you click join plan. So on this page, it shows you all of the different expected coverage effective dates based on which enrollment period you're currently in. So if you are applying for a Part D plan or trying to switch your Part D plan during the Medicare annual election period, which is October 15th to December 7th, your plan will automatically begin on January 1st of the following year. And you can walk through all of these other enrollment periods and it lets you know when you can expect your plan to begin. I will ask you to select which enrollment period you're in. I'm just going to click I'm new to Medicare, and then you would continue to enrollment. Here you're going to enter in your Medicare number, your Medicare Part A and B coverage start dates. And then you'll go through and check this box that you've read and agreed to the information provided. On the next page, they're going to ask you to confirm your name, your date of birth, your address. They'll ask you questions about whether or not you're in a long-term care facility or whether you'll be receiving any other type of prescription drug coverage along with this Part D drug coverage. So if you have VA benefits or any other type of drug coverage benefits, you'll need that information as well. At the end of the application, you'll be able to click a button to submit it. From there, you'll be given a confirmation number. You do want to save that number, and then the drug company will be reaching out to you, usually within the next 2 weeks, with your enrollment information and your welcome kit. So it's really important to have this base knowledge and know how to shop on Medicare.gov for Part D. If you ever have any questions, please let me know. We do assist all of our Medicare supplement clients with annual Part D policy reviews. So please feel free to reach out to us. Thanks again for watching, and we'll see you soon.